Allergies. Yeah, like seasonal allergies, like the sneezing, the pollen, that kind of stuff. Allergies, if they are untreated, can absolutely make you tired, feel kind of like groggy, tired, a little bit out of it. Now, of course, allergy medications, many of them can also make us feel groggy as well. But this video, we are focusing on medical conditions that can make us feel tired, fatigued. Next one is thyroid disease. Yeah, typically I think of like underactive thyroid, but the thyroid, I always think that the thyroid is like the engine of the body. When your thyroid's not right, it can do a number of things. So thyroid disease can absolutely make you feel tired. Next thing, number 3, we have like 13 or 14 of them. We're going to go quick. Anemia. Oh my gosh. Okay. Anemia, that's a low blood counts, by the way. Low blood counts can absolutely make you feel drained, out of it, exhausted. Okay. Next thing is depression and anxiety. Yeah. A number of my patients know when their mental health is not right by like how tired they are, sluggish, feeling like they want to sleep, that type of thing. Because for some people, depression and anxiety exacerbations can really cause a lot of fatigue. Next one is cancer. Yep, cancer and also cancer treatments, of course, but cancer can make us feel tired. But then there's also chronic fatigue syndrome. You guys have probably heard about that. There's actually a newer name, myalgic encephalomyelitis, ME/CFS is oftentimes what we see. I have a whole video on chronic fatigue syndrome. By the way, I have videos on all this stuff. I'll link as many of them to this video as I can. Like I have videos on anemia, thyroid disease, chronic fatigue, pretty much everything that we're talking about. So make sure you take a look at those. But chronic fatigue syndrome, absolutely. And I do think that it's a real disease. A lot of people are like, chronic fatigue is not a real disease. I do think it is. Okay. Along those lines, though, is fibromyalgia. That's another condition that a lot of people don't actually believe is real. I do believe it's real. We have criteria to diagnose it. We have FDA approved medications to treat it. And one of the symptoms for many people is fatigue. Okay. Chronic kidney disease. I see this especially when my patients, when their kidney really, really starts to get much worse, when their kidney function gets worse, when they start getting close to dialysis. And certainly my dialysis patients experience this as well. But kidney disease can absolutely cause fatigue. Diabetes. Now, you may not be thinking about this one. Generally, when I see diabetes causing fatigue, it's with somebody who's a diabetic, but their sugars are not controlled. I don't usually see this in my patients where their sugars are controlled, they're taking their meds and this and that. We're talking sugars are like in the hundreds, multiple hundreds, okay? And that really can cause you to feel fatigued and sort of out of it. Vitamin D deficiency could contribute to some fatigue, absolutely. Mononucleosis, that's a classic condition caused by the Epstein-Barr virus, where we typically get it when we're younger, like teenagers, stuff like that. Mono is classically a condition that causes us to feel tired. And then just a few more. Sleep apnea, huge. Okay, I have a video on sleep apnea. Sleep apnea, I feel like it's probably underdiagnosed. And I do think a lot of doctors feel this way. I think many of us are making concerted efforts to make sure we are diagnosing and assessing people properly. Untreated sleep apnea, undiagnosed sleep apnea, if you're not being treated, can absolutely cause you to be fatigued. So I should also say this, if you are fatigued, you need to be talking to your doctor. That's one of the points of this video. Talk to your doctor because there may be a medical reason as to why you are fatigued. Don't just assume it's because you're just tired, okay? The last couple of things are neurological conditions, Parkinson's and multiple sclerosis, other things. And then finally, pregnancy. As we know, pregnant women often feel fatigued. They are growing a whole human in their bodies, so that human is taking up resources, which of course we're happy about. But yeah, pregnancy can cause fatigue. There are plenty of other reasons for fatigue. This is just, I'm just scratching the surface, and this is just medical conditions. I'm just focusing on that. Take a look at my other videos. Let me know if you are fatigued, if you were fatigued, found the cause of your fatigue, what it was. I always say your comments often help other people. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. Please follow me on Instagram, WhatsApp, etc. And, at Dr. Jen Caudle. And please go to my website, www.drjencaudle.com, so you can sign up for my free health newsletter. Guys, love y'all. Bye.